Thanks for joining us. We want to go straight to a news conference happening right now at Mercy Medical Center in Roseburg.
I can assure you our team was ready. They were prepared. There was compassion, there was caring, there was professionalism. For all of us here in Roseburg, we couldn't be more proud of the hospital team that we had. We also had 10 people that came to us at the hospital. Dr. Jason Grays, our Chief Medical Officer, is going to give you a little bit of update on those patients that were here.
Jason Gray, Chief Medical Officer and anesthesiologist. So yesterday we received 10 victims from the UCC shooting. Of those, 3 were transferred quickly to a higher level of care. 2 were treated and released. 4 underwent operative intervention here. Of those, 1 has already been discharged and 1 will likely be discharged today. And there was 1 that was deceased in the emergency room at arrival. The 3 that remain are expected to recover well, and at this point remain in stable critical condition.
And it's a small town. How do you train for a mass casualty incident like this?
You know, we have community-wide training events for this exact situation as part of the Oregon trauma system, or a level 3 trauma system, and we integrate with the level 2 and the level 1 trauma hospitals throughout the state.
Can you give us any indication on who these victims are? Young, old, male, female, anything?
You know, they're mixed, male and female at this point, of varying ages.
And we also want to honor the privacy for the patients.
Correct.
So that's all we're going to provide for you today.
You know, the age span I would say was on the younger side.
Doctor, if you could say again, there were 10 patients here, and just explain that again. You just went over.
Sure. We received 10 patients from the UCC. Of those, 3 were transferred to a higher level of care for services which we don't have available. 2 of them were treated and released from the emergency room. 4 of them required operating room procedures. 1 patient was deceased in the emergency room. Of the 4 that underwent surgical intervention, 1 was discharged yesterday, 1 will likely be discharged today, and the remaining 2, 1 is in critical condition and 1 is in stable condition at this point.
Can you say what type of injuries?
You know, all of the injuries were gunshot wounds to abdomen, thorax, head, extremities at this point.
Can you explain there's a disparity between the sheriff's office saying there were 7 people wounded and you're saying that there were 10 people admitted?
I cannot explain that. I know we received 10 patients in total, and that's the information that I can vouch for.
Talk about the challenges dealing with when you have so many people coming all at once. How do you respond?
You know, from a medical standpoint, we're trained for this. Obviously, it's an overwhelming situation, but we practice it. The outpouring of the community, the outpouring of our staff coming in on their days off, retired physicians coming in, nurses coming in, staff coming in. One of the challenges, honestly, is coordinating support for the friends, the family of the victims, and coordinating information. Been very difficult.
Dr. Gray, we've heard time